Matthis, doctor of chiropractic with Tuck Chiropractic Clinic. See patients in our Christiansburg office. I've been there for about 12 and a half years. I also wear the title of Vice President of Clinic Development and Professional Outreach. So basically, if there's something to be spouted to our profession, I'm the young man that gets the nod. I'd like to think that whole health encompasses all the person. You know, their mental, their physical, their relational health can all be affected by pain. And the majority of our patients that come in are in pain, and one of those aspects of their lives is being negatively impacted. So I like to find out which one and how it's feeding into the other aspects of their lives, and see how we can, impact the person completely. A lot of folks come in dire straits. They're at one of the lower points in their lives, and they've come in our office seeking help. When they find out how we can help them, oftentimes there's the desire not to go back. They've learned that lesson, and they like to do everything in their power to keep that from returning. We do offer elective and maintenance care to our patients should they choose to follow through with that recommendation. We do offer that, and it's if you learn a lesson once and you want to not have to learn that lesson again, is sort of the way I put that to a patient. We work real hard. I use analogies a lot. So I'll tell a patient, when you've crashed your car, we've got to work. It takes time and money and effort to rebuild the car. After it's rebuilt, it's a good idea to rotate the tires every once in a while, or change the oil every once in a while, so that it does perform at its best. That doesn't mean you might not have another accident or might not have another episode of care, but it does mean you're doing everything in your power to try and minimize the chances that occurs. Pain is a great hindrance to a lot of things, and it can be from a relational standpoint. If somebody's back's hurting, one of the last things they might want to do is get up and go for a walk, even if that does mean going for a walk with their spouse, or going with down to the park to play with their children, visiting their neighbors to maintain a relational status in their community. The maintenance aspect of that is what I like to offer, so that patients know that they can continue to live life on their terms. If they would like to do something, chiropractic can oftentimes play a role in seeing that they continue to be able to do what they'd like to do. There's a long laundry list of that set of what we refer to as self-management concepts. Diet and exercise, a good healthy relationship, be it an intimate relationship or having good close friends, so social life, home stretches and strengthening again goes along with the exercise concept, to minimize and mitigate any returned episodes or returned symptoms. Laugh a lot, drink a lot of water. Some pretty basic stuff that has a great impact.